Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer and Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, our guest today is Ilsedora Laker. Ilsedora Laker is the lead instructor in the English-speaking world of the German New Medicine, which is what we're going to be talking about today. You can find out more about Ilsedora Laker and her wonderful work at two websites, gnmonlineseminars.com and newmedicine.ca. Welcome, Ilsedora Laker.
Thank you. My pleasure to be here.
Now, Ilsedora Laker, for decades, I've heard about the German New Medicine. What is the German New Medicine exactly, and how was it discovered?
Well, in a nutshell, and this is a loose interpretation of what it really is, it would qualify as mind-body medicine. But this is the real deal. That's the difference. This mind-body medicine, or at least what Dr. Hammer discovered as the new medicine in 1981, verifies the mind-body connection. So this is highly scientific. Everything is verifiable. All of his research has been empirical.
So what exactly is the German New Medicine?
Well, essentially, it helps us to understand the origin of all disease and the way all diseases behave. Now, that's outside of poisoning. So that's a little bit different because here we're talking about an external thing. But when the individual has an experience that they didn't expect to happen, this is when those biological programs are unleashed. And it's the very specific kind of conflict that an individual has that will strike a certain area in the brain, which has a connection to the organ. So the moment that we have one of these unanticipated events, the psyche, the brain, and the organ are simultaneously affected in a split second. And of course, the nature of the conflict is going to determine the organic site as well as the site in the brain.
Now, one of the things that we know here and at the Natural Healing Show for UK Health Radio is that we hold emotions specifically in our organs. And there's different emotions held in different organs. So for example, you hold anger in your liver, and you hold restlessness in your bladder, and you hold worry in your spleen, and you hold fear in your kidneys, and I could go on. And also, one of the things we know, scientific research shows that when it comes to acupuncture, you can touch a specific acupuncture point on your body, and the corresponding region lights up in your brain. And you can touch that region in the brain and the acupuncture meridian will light up. So we know that there is a direct correlation between our emotional health and what's happening physiologically in the body and also corresponding in the brain. Now, Ilsedora Laker, lead English-speaking instructor of the German New Medicine, who was Dr. R.G. Hammer, who's now deceased, I understand, who developed the German New Medicine.
Well, Dr. Hammer was a traditional medical doctor. He was an internist. At the time that this tragedy happened, which was in 1978, he and his wife were in a medical practice in Rome. He's a German, she's German, but his mother was Italian. So they did live in Rome at that particular time. And his son, Dirk, was on a school trip on, I think there were 3 boats involved, 3 private yachts, all filled with students that went to the Isle of Cavallo. And it was on that trip that he was accidentally shot by the Italian crown prince. It's a long story. You know, if anybody really wants to read about it, they can go to my blog. It's called the Dr. Hammer Tribute, and that gives you all of the information that of how it all began. But when his son was shot, his life literally hung in the balance for 3 months. And he died in Dr. Hammer's arms in early December. And by March, Dr. Hammer had developed a testicular cancer. And at the time of his diagnosis, he was given a 2% chance to survive this because he developed some severe complications. And of course, as you know, he did survive it. But at the time, both he and his wife began to question the onset of his testicular cancer and that it might be related to the death of their son. His wife, as a matter of fact, developed a breast cancer a few years after that. So, but she died of a heart infarct, not of a breast cancer. Now, Dr. Hammer, 3 years later, got a position. It was at a gynecological clinic, a cancer clinic that was associated with the University of Munich at that time. And he had 170 patients in his care. And it was there that he took the opportunity to begin to question his patients as to whether or not they also had a shock that they didn't expect to happen. And it seemed that every case that he investigated, and these were gynecological, in other words, reproductive cancers, which is what he had, they all verified that they did indeed have a biological shock, which is what he calls it, that happened to them before the onset of their cancer. And this is how his research began.
And my understanding is in the German New Medicine, and I'm going to summarize for our audience, if you experience a sudden, unexpected, highly emotional event, such as your son being shot by an Italian prince, that it causes an effect in the brain, a ring, as I understand it. Correct?
That's right. It's a target ring, like a bullseye. And, you know, he didn't realize this in the beginning. He was still working at that clinic at the University of Munich. And this was in his first year. And he was actually working, he was on duty in emergency. And they brought in a patient that was unconscious, and they were told that he had had a heart attack. So, of course, when someone comes in unconscious, the protocol is to take a CAT scan. And this was a new technology in 1981. They'd only had it for a few years. It was only devised in the 70s. So at that time, Dr. Hammer, of course, he was one of the first to look at the CT. And that's when he realized that there was a pocket of edema in the brain, which was the cause of his unconsciousness. But that's when he started to understand that it was actually the brain that was facilitating what was going on the physical body. He already understood the experience and the organic connection, but the missing piece at that time, or until that time, was the actual brain. And it was from there on that he began to very greedily grab every CAT scan that he could and compare it to illnesses that patients had been diagnosed with. So from there, he remapped the brain, which is quite astonishing.
Now, and what did Dr. Hammer call these rings in the brain that look like bullseyes? What did he call them?
It's a little bit egotistical. He called them a Hammerschen Herd.
A Hammerschen Herd?
Yes. Herd, really loosely translated, would be lesion. So this would be a Hammer lesion that looked like a target ring. And these target rings, they do transform along with your experience. So the moment that you have a biological shock, in other words, an unanticipated event, you can see a very clear target ring. But as that conflict diminishes, we can't always resolve it, right? So as it diminishes, it starts to transform, and we can see that it becomes downgraded in the brain. However, when we resolve the conflict, it transforms once more. So we start to see the actual breaking up of this target ring or this lesion when we see that it's going into what we call the resolution phase or the healing phase.
Now, one of the things that I know from my 28 years full-time experience in natural healing as a medical intuitive healer, that every disease, literally every single illness you experience, has an emotion associated with that.
Absolutely.
Absolutely, Ilsedora Laker confirms. And when you want to heal, it's absolutely critical that you identify and release the emotions that are holding that illness in place. Because if you don't, you fix your elbow, you hurt your knee, you fix your elbow and your knee, and then it goes into your back and it goes someplace else. So the energy simply moves around in your body until you release and deal with the emotions.
Exactly. And most of us don't release that. We'll carry it. And as Dr. Hammer recognized, it becomes diminished. Otherwise, we would be in high stress all the time, but we're not. So, when we are in high stress, we have to recognize that if we're going to start living our lives according to these biological laws, we have to recognize when we're in the conflict active phase. That means that we've got cold extremities. We wake up at 3 o'clock in the morning, our appetite goes down, right? So these are things that we need to pay attention to. And then when we resolve the conflict, and if it was a really important issue, that's when we will have the onset of some diseases. Now, about 60% of all diseases known to man are only going to happen when we resolve something. And this helps us to explain, or to at least to understand, when we're looking at traditional Chinese medicine or Ayurvedic medicine, they identify cold diseases and hot diseases. It's the hot diseases that occur when the conflict has been resolved. The cold diseases occur during the conflict activity.
Interesting. Now, in my work as a medical intuitive, part of what I do is I identify the emotions that are holding a disease in place, as well as the thought patterns or the beliefs.
Yes.
So, we have this mental operating system that's your mind controls your emotions. Now, Ilsedora Laker, lead English speaking instructor of the German New Medicine, what is the iron rule of cancer? You talked about how Dr. Hammer invented the German New Medicine from his own experience with cancer. What is the iron rule of cancer in German New Medicine?
Well, the first thing that we have to understand is that the DHS, or what Dr. Hammer called Dirk Hammer syndrome, in honor of his son, is the moment in time that we experience a biological conflict shock. In other words, it's something we didn't expect to happen. And for some people, it's like a bolt of lightning going through their body. I've experienced that, so I know what that's like. I'm sure everybody has experienced it to one degree or another. So when we have that biological shock, it initiates a process within the physical body, or it could initiate a process in the mental body.
Fascinating. And what is exactly the iron rule of cancer?
Well, it's the biological shock. That's really what it's all about. And that really means that simultaneously the psyche, brain, and organ are affected, and a disease process is initiated.
So what you're saying is, according to your experience in the German New Medicine, every cancer is going to be originated by some kind of shock.
Absolutely. Now, there are some exceptions, because we are looking also at some very, very serious environmental toxins, which behave very similarly to the physical body as a biological conflict shock does. For example, radiation. So if people that have been exposed to high levels of radiation that radiation, of course, can affect us dramatically on the organ if we survive it. So this could, in the case of someone that lived in Chernobyl, for example, if someone had a very high level of radiation, it could destroy their thyroid function, or it could perhaps give them a leukemia when the radiation begins to leave the body, because the leukemia or the leukemic phase is actually a recovery phase. So during the conflict activity, they would experience some severe anemias, but as the radiation leaves the body, then of course the leukemia would set in.
Now, as you know, Ilsedora Laker, at the present time, all over the world, we are experiencing the coronavirus pandemic. And for many of us, I can remember a year ago when everything started to change, and it was a shock. It all happened so quickly. It's almost like we went, from our normal life to this lockdown life in a period of less than 30 days. What is the view of German New Medicine about the coronavirus pandemic?
Are you sure you want to hear it?
Let's hear your point of view.
Well, according to Dr. Hammer and his discovery, and I can verify that, and so can all the others that were his students and have lived, eaten, and breathed the German New Medicine, there is no such thing as a virus. There are inflammatory processes. Of course, there are scientists that have verified this. And there are a lot of people out there right now that are very vocal about that particular point. So what Dr. Hammer began to question when he discovered the 5 biological laws, he understood that microbes had a very, very specific purpose in the disease process. They are either to degrade something that had developed during the conflict active phase, for example, a cancer, a lung cancer, for example, a pulmonary cancer. Those cancers develop during the conflict activity, and they actually stop growing when the conflict has been resolved. But if we have the appropriate microbes, which in this case would be related to tuberculosis, then those microbes would begin to degrade what had developed during the conflict activity in the body's attempt to normalize the tissue. However, that in itself, depending on the individual and where they were living at the time, the era they were living in, their physical status, etc., did they have access to high nutrients, or were they living day to day, hand to mouth? Depending on their individual situation, that would determine whether or not they would be able to survive this healing phase, which we call tuberculosis. So that is one reason why the microbes would be active in someone's system. Now, we also have microbes that will help to reinstate or to heal certain tissues that were damaged during the conflict active phase, for example, the bone. So the bone is healed with the help of certain bacteria. So microbes do have a purpose. It's just that we've completely misunderstood this. Now, in the beginning, Dr. Hammer started to question the validity of the virus theory. And the reason was that he saw that whenever there was a diagnosis or a suspected virus, that a very specific kind of cellular structure known as ectodermal cells was affected. These ectodermal cells are actually the latest addition to our physical body. They were the last to develop. We have 3 germ layers. The ectodermal is the outermost germ layer, and it also covers all of our skin. Our body is covered with these ectodermal cells. So during the actual conflict activity, these cells will ulcerate. This is at a microscopic level. But as soon as we resolve this conflict, this is when the inflammatory condition will kick in. Now, there are some conditions, for example, there are some organs that are also comprised of these ectodermal cells. They have invaginated into the lungs and they cover the bronchi. So if we look at the bronchi and we understand what happens during the conflict active phase, then we know that they will ulcerate. However, when we resolve this conflict or we come to terms with the conflict, the healing phase will begin to kick in. And that means that there will be inflammation and irritation. And that inflammation and irritation will cause us to cough. This is what we know as a respiratory problem or a respiratory infection. Now, some doctors would say that this was a virus. Other doctors would say, no, it isn't. You see, so the reason that one would say one and the other would say the other is because they really don't know. That's because a virus has actually never been isolated underneath a microscope. It's really just a suspicion. Now, this is something that was set into motion in the last century when we got the electron microscope and they were able to finally identify some bacteria. However, they were never able to clearly identify a virus underneath an electron microscope without first going through a highly convoluted process, which actually destroyed anything that was left of the tissue that they were trying to analyze. And this is what they called a virus. So it hasn't been proven. It has not been substantiated or verified. It is still a suspicion.
Thank you for sharing your point of view. Now, Ilsedora Laker, why are many health conditions referred to as healing phases in the German New Medicine?
Well, you know, they're actually repair phases, and that's why we call it a healing phase. And as I mentioned earlier on, 60% of all of our diseases are hot phases. Traditional Chinese medicine and Ayurvedic medicine already confirms that. And some areas of conventional medicine or Western medicine also understand that we do have hot diseases. The flu is a hot disease because we develop fevers, right? We're looking at inflammation. We've got aching muscles. So all of those are repair phases when we have fevers and inflammation. Here we could be looking at an arthritis, you know, where we have an inflammatory process, not necessarily a fever, but then a fever also depends on what part of the brain has been affected.
Now, Ilsedora Laker, what is the process that someone would go through if they were experiencing German New Medicine? Do you identify when the shock first occurred? Do you identify the emotions? Do you identify the organs being affected? How do you go through your process?
Well, first we need a very clear diagnosis because Dr. Hammer has been able to identify very, very specifically what kind of shock or what kind of biological conflict is responsible for any given disease. So that's a very good starting point. We have a very excellent reference in the scientific chart of the German New Medicine. And he devised this already in the beginning when he began to understand the law of two phases, which is the second biological law, and how all of our diseases fit into those categories. Now, when we begin to work with a patient, we already know what to look for, the kind of conflict to look for. So it's very clear, very precise, and you usually, if you understand your work well, you don't have to look very far. But the trick, of course, is to get the client to allow it to surface. So sometimes we have to dig a little bit, especially in people that aren't very much in touch with themselves or their emotions or their experiences. Now, there's one other thing that, you know, if we have difficulty in isolating the specific kind of conflict, it's because it's buried so deep that the client cannot allow it to surface. There is a reason for that. If it's buried deeply and we allow it to surface, there could be repercussions, you know, and this is where we really need to be careful where psychotherapy is concerned, because we may be opening up a can of worms that could put the patient into a healing phase, and then they don't know what to do with it.
So are you using kinesiology to determine when this shock occurred? Are you
Not at all.
talking to the person?
Not at all. No, it's really a matter of understanding the work. And for example, let's say a breast cancer patient comes in for a visit. If they have an introductal breast cancer and they were recently diagnosed, then I always look for something that was resolved with respect to a relationship not long before, perhaps 6 weeks before they actually found the lump in the breast. So that's a good starting point. So we know something was resolved. So by identifying what was resolved, we can backtrack and understand where the conflict actually originated.
Fascinating. Now, Ilsedora Laker, how can we recognize a conflict active and a resolution healing phase?
Well, when we wake up at 3 o'clock in the morning, that's one of the first things that we should look for. That means that we have either just had a biological shock or the old wound has been reopened, which is a very strong possibility. I have noticed that a lot of diagnoses occur when that wound has been reopened. It's not the first time that you have a biological shock that the physical body always responds. It's the second time. So that's what we look for. Waking up at 3 o'clock in the morning, you have poor appetite, cold extremities. You might have chills during the day, right? So that's all a sign of conflict activity. Plus, your mind's always preoccupied. Now, when we enter into the healing phase or the resolution phase, we have the opposite symptoms. We have warm symptoms. We have warm extremities. Our appetite gets better, right? We wake up not at 3 a.m., but we have difficulty getting to sleep until 3 a.m. So if you have trouble getting to sleep until then, we know you're in a healing phase.
Very interesting. Now, Ilsedora Laker, is the German new medicine relevant for both physical and emotional symptoms, or one or the other?
No, absolutely, it is. Dr. Hammer found in his research that schizophrenia is developed out of biological shocks. And he discovered also, because we have two brain hemispheres in the cortex, that the majority of our schizophrenic constellations, as he calls them, are the result of conflicts that are active in both hemispheres of the brain. And this disturbs the natural rhythm of the brain and creates a kind of a mindset or a mental disorder. Now, we can have also a depression, which comes from the right hemisphere of the cortex, or we could have agitation or mania, or people that are simply very motivated or even hyperactive on the left hemisphere of the brain. So depending on how much activity you've got on one hemisphere or the other, that's really going to determine your character, whether or not you're a mover and a shaker, or whether or not you're a couch potato.
That's interesting. My first 10 years out of 28 years in natural healing was spent learning about the brain and how to heal the brain. And what I find as a medical intuitive healer, again, it's critical that you identify the emotion or emotions that are holding a disease in place, but also the age or ages at which a significant event happened. So for example, I just did healing work with a client this morning the client is currently 49 years old. Well, when I went back in time to when the pattern started, it started at age 22. So she's currently experiencing fatty liver disease, according to her medical doctor. And we're doing not just physical detoxification, but we're doing mental, emotional, spiritual clearing work to clear the emotions that held in place. So I always start with a person's current age and then go backwards in time, asking at the soul level, what is the event or events at which some significant emotional event happened, And when she was 22, she was very unhappy and for a number of reasons. And she began a period of self-destructive behavior.
Mhm.
So we identify the age, we identify the emotions, we talk with the client about what happened, and then we do healing work to release the energy
Mhm.
of that event that she's holding in her mind body system that's holding that illness in place.
Yes. Well, it's relatively simple in the German New Medicine, and I work exactly the same way. I go back into their history and I look for the what I call the programming conflict. You see, when we have one of these shocks or DHSs, there is, and this is the way I see it, and this is the way I explain it to my student, there is a very special compartment that is established in the subconscious mind. And all of the important information that you experienced during that moment of the shock, however long it lasted, is going to register in that compartment. Now, what's interesting is that any of those little bits of information that registered are going to be responsible for opening up that old wound in the future. And these are what we call tracks. Now, a good example of a track affecting your physical body would be an allergic response. So if you were perhaps eating something that was part of the scene of the crime, as I call it, for example, an orange, you were eating an orange at the moment that you had the DHS, or you were drinking orange juice, that will register. So the next time that you eat an orange or have a glass of orange juice, you're going to get a reaction. And that reaction is going to be based on specifically how you experience that moment of the shock. For example, if your boyfriend just broke up with you while you were eating the orange, you would experience a separation conflict. And a separation conflict would express itself in a skin condition that we call hives. So if you have a separation while you are eating something or exposed to something, then you will get a reaction the next time that you are eating something that reminds you of the biological shock.
That's a really great explanation for many people's food sensitivities.
Exactly. How many shocks do we have while we're watching TV and eating dinner or at the dinner table?
Watching the news while eating.
Oh, yes, absolutely.
Yes, or family arguments during the dinner table, at the dinner table.
Yeah.
Yeah. So now, does the patient or the client have to know anything about German New Medicine to benefit from receiving this technique?
Absolutely. And the reason is that the law of two phases, when someone is in a conflict active phase and they have a cancer that is actively growing, we have to shut that down somehow, right? We have to understand all of the conflict in its entire context to make sure that there are no tracks or anything that are going to wreak havoc in the future. So we have to be very, very thorough in understanding what the scene of the crime was all about. Now, the patient really does need to actively work with the consultant and live in more awareness than they had been. You know, we live unconsciously, we really do. But, you know, I think the discovery of the GNM and how our life situations actually affect us physically, I think that has opened up a new doorway to perhaps allowing us to live more consciously and to rethink our actions. You know, when we're in argument situations or when we're acting out on an anger or something, then we have to rethink our actions and try to make sure that we're not going to affect someone else in a very negative way. So I think this is a new kind of spiritual awakening for mankind to be able to live their lives more in a state of harmlessness, all the while being more conscious of the way they live and how they perceive life.
Now, let's say Ilsedora Laker, someone's listening to this interview and they recognize, wow, I have just gone through a series of shocks. So, for example, globally, the massive changes that we have all experienced in our lifestyle and our work, in the way our children are educated at home, and just in lockdown, that's put a lot of people in a state of shock. So if someone recognizes, wow, I've just gone through a series of shocks or a major shock to my system, what can they do to begin to unwind the shock out of their body?
Well, the first step is understanding that you did have a shock, and then how it has affected you personally and your life. You know, there are a lot of people that have awakened to what is really going on. And then there are a lot of people that are still very much asleep. And those people that are still asleep are the ones that are still in the state of shock. Because once you have a DHS, you go into a kind of a trance. I call it a voodoo spell. You know, it's the same thing when you're diagnosed with a serious illness. You go under a spell, and every ounce of your being is going to be around surviving. And that's really what 50% of the population of the world is going through right now. They are still in that state of mind where they had that shock about the pandemic. They're frightened for their lives, and we see it in their faces.
So I know for myself, there's techniques that I use to release shock out of the mind body system. And what's interesting for me is that it's the same technique will work whether it's a physical shock or an emotional shock.
Mm-hmm.
So, for example, after 9/11 here in the United States, when terrorists flew planes into the World Trade Center, I spent the entire month afterwards as a healer taking all my clients out of shock. And that's the same technique that I use. For example, I've had clients, they were working on the roof of their house and the ladder fell off and they had to jump off the roof and the body experienced a shock. Yeah. So shock puts your nervous system into fight, flight, or freeze.
Right.
And that's one of the ways you can tell whether or not you're in shock is you're in a state of fight, flight, or freeze. If you feel like you're living in survival mode, you may indeed be in shock. But just recognize there are techniques that you can use to get out of shock. And one of the videos that I have on my YouTube channel has a technique for getting out of shock. And I put it there. It's a simple technique so that if you recognize you're in shock, you can clear the shock yourself. You also have to check to see how many layers of shock that you have. Because
absolutely.
Frequently, if you are in shock, you know, I worked with somebody recently, 35 layers of shock. That's not uncommon. So you recognize you're in shock, and then use natural healing techniques to take yourself out of shock. And once you get out of shock, what I find also is that there's an exhaustion phase that follows, because when you're in fight or flight, at the organism level, you're all geared up, you're juiced up, your stress hormones are running. And then when you come out of the shock, you breathe, you exhale, and you go into a rest and recovery phase.
Absolutely right. Well, that's a very clear explanation of the law of two phases.
Yes, absolutely. Now, Are nutrition and lifestyle changes suggested in the application of the German New Medicine?
Well, that was my background. My husband and I started in natural medicine in 1978. And, we were strong believers in good nutrition. We still are. We were avid fasters, and we thought that we could conquer cancer just with our diet and lifestyle. But that wasn't the case. Now, we had some successes, yes, but there were other situations that did not respond the same way. So we began to actually question what we were doing. And it wasn't until 1992, when I had my first exposure to Dr. Hammer's work, that we began to really understand that he held the key. In other words, there had to have been a biological shock in order to get the sequence going, the disease sequence going, and that some of our patients would be in a conflict active phase and other patients would be in a healing phase. We began to realize that our results were primarily in healing phases. In other words, what we were providing the patient with diet and lifestyle changes was really just to help facilitate the healing phase and to take the stress off the healing phase.
Great explanation. And, you know, here at the Natural Healing Show, we do talk about nutrition.
Yeah.
I've taught yoga for myself for 26 years, but I say to people, you know, healing is not just celery juice and yoga. When you're taking a true integrated approach, you're looking at mind, body, and spirit.
Mm-hmm. Absolutely.
Now, what would it mean if everyone were to understand the basics of German New Medicine? What would be different?
Wow. I think we would be on the at the beginning of utopia. Really, I mean, if we managed to resolve all of our conflicts and stopped inflicting them, like I said before, it would really accelerate us spiritually. And we would have a much better health.
Now, for our audience, we do need to talk about the fact that during his lifetime, and Dr. Hammer is now deceased,
Yes.
was imprisoned multiple times.
Right.
So why was he imprisoned? What did the authorities have against him? Because there are many of us in natural healing who've done our work peacefully with no interference for decades.
Well, I think early on when Dr. Hammer came out with his research, and this was, I think, 1982, 83, he found that all the doors were closed. Nobody wanted to know. The repercussions of his findings would affect all of medicine, regardless of whether it's traditional or natural, in a very dramatic way. We have to rethink everything that we believe about medicine, because most of it is wrong, according to what Dr. Hammer has discovered. And I can verify this. I've been working this way since 1992. So we're looking at close to 30 years. I can't believe it myself, but you know, that's a 30-year observation of whether or not Dr. Hammer was correct or not. He has found the key to how a disease is initiated and how it progresses. What is most important in understanding his discovery is that when you have a diagnosis of cancer, for example, we have a biological shock, right? So that means that the cancer is going to progress to another organ depending on how you perceive that shock. Essentially, that is the cause of metastasis. So if we look at metastasis correctly, traditional medicine has interpreted metastasis as a cell swimming through either your bloodstream or your lymphatic system and creating another cancer somewhere else in the body. Now, with Dr. Hammer's scientific research, we understand that's impossible because usually the kind of cancer that a person is diagnosed with is completely unrelated to the type of cancer that they will develop as a metastasis. So when he actually saw this progression in the brain, he could begin to predict where the next cancer would develop. So that's one point. The other point is that when we understand that the cancer that we have been diagnosed with is already resolved, then this takes a great deal of stress away from the patient. In other words, they will have more confidence to help them to overcome this cancer rather than wondering when the next diagnosis is going to be and what they will have to do with it. So it's a life-altering research that Dr. Hammer has discovered. Now, that threatens all of medicine. We know that, right? Because traditional medicine is based strictly on 3 protocols: cut, burn, poison, right? And not many patients survive that. Now, what's interesting also is that Dr. Hammer's first trial, they seized 10,000 files. This was in 1996, I believe it was. And they seized 10,000 of his files. It was 6,500 files over 10 years. At any rate, they began to follow up on those patients, and they found that out of those patients, that 90% of them were all still alive after 10 years after their diagnosis, and that's almost unheard of. Now, they wouldn't even allow that evidence into the court. Now, the reason that he was arrested was because they got him for practicing medicine without a license, not for malpractice, because they took away his license when they understood that he would never return to traditional medicine and practicing their way. So they took away his license, and then they found 2 doctors that actually conferred with Dr. Hammer regarding their patients, and so they charged him with practicing medicine without a license. Now, he was actually imprisoned for 18 months in Germany during that time, but his lawyer took his case to The Hague, and The Hague looked at his file and said that he was unjustifiably imprisoned, and they let him go literally one day to the next. So that was in the 90s. And then in 2000, actually, when I met Dr. Hammer when I visited him for the first time in Spain, this was 2000. It was February 1st, 2000. And that's when the official proceedings began in France, where they actually wanted to charge Dr. Hammer with the same thing, practicing medicine without a license, but in his absence. Now, he was living in Spain at the time, but what they did was they charged him and they tried him. And as soon as Spain joined the EU, they arrested him and carted him off to France. And again, he was imprisoned for about 18 months and unconditionally released because they found that there was a conspiracy against him from a specific group.
Thank you for sharing that legal history. Now, my own view here at the Natural Healing Show, in my own 28 years of experience, my view as a medical intuitive healer is that there's a lot of wonderful tools. People have been healed by traditional medicine. They've been healed by acupuncture and Ayurveda and homeopathy and nutrition. So there's wonderful tools that we can use, and it's about finding the right tools for each person that are going to unwind their illness. You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Our guest today, Ilsedora Laker, lead instructor in the English-speaking world for German New Medicine. You can find out more about Ilsedora Laker at gnmonlineseminars.com and newmedicine.ca. And remember, thank you so much for listening. You can heal yourself naturally. See you next time.